logistical concerns today. But so we thank Ma'am Carol for the talk. At this point, I'd like to introduce our next speaker. Next speaker is Bertie Salva. He is the general manager and co-founder of Curiosity, a design research consultancy that provides local insight through ethnographic approaches to help organizations design new products and services. In the past 6 years, Bertie has been involved in over 100 research projects for companies like Ayala Healthcare Corporation, Globe Telecom, Sun Life Financial, the Fred Hollows Foundation, and the National Anti-Poverty Commission. Prior to starting Curiosity, Bertie was a user researcher at the industrial design startup Innovent, a brand manager in L'Oreal Philippines. So let's have our hands exercise and welcome Bertie. Good afternoon, welcome.
Okay, so thank you everyone for having me over. I think it's been more than 10 years since I last stepped to the campus.
How so you've been here?
I attended an industrial design talk way back then. So it's nice to meet you. So, I guess you're all doctors, pharmacists, you're all in the healthcare field. I'm not. You know way more about this than I do. So what I would like to share with you today is how we help medical institutions or let's say organizations when they are designing for in the healthcare field. So what we do in Curiosity, we're basically a design research agency, and we basically is qualitative research. I believe maybe yesterday you had your session on qualitative research. So I'll be touching very quickly upon that now to show you how we do things. And we mainly use that and ethnography as our main tool and lens for when we try to test our products and services. So depending on the project that we need to work on, we just basically get from whichever technique that we need to do. Either individual interviews, observations, immersions, and focus groups, usually testing of a prototype, shadowing them for a whole day. We just choose whichever is most for each. So very quickly, why do we use ethnography? And I guess it's one of those things now, what we've been learning through the years conducting this is that just simply doing the interviews, it's not enough. People can say one thing, but they'll do something else. And it's very different from what people think na parang this is what I want to do, this is how I believe I will do things, this is how I believe I will behave given the situation. Pero iba eh, once that they're in the situation, they will behave differently. So we do think na parang by immersing with them, getting them, seeing them as they interact with the product, with the services, you'll really learn more. So when we do ethnographic research, again, what we want is something, a very holistic perspective. We believe na whenever, So we believe when we're testing products and services of our clients, it's not simply that we present it to them once and they give their feedback and that's it. That's the end of things. We know that when they get to try something, there's a lot of many variables that go into play that determines on why they will behave certain ways. So for example, let's say Ayala, they once asked us about, okay, market research namin shows that people says healthcare is very important. However, the same research shows that titiisin nila hindi sila pupunta sa doktor. So bakit? Yun yung mga gusto nila malaman. And then they had an idea parang what if we create yung family, what is now known as family doc, parang what if we create a primary care chain clinic na mura, not as complete as a hospital, but hopefully better than the free barangay health center. So they're wondering, pero will people pay for that? Will people go to, what value would it add given na kung libre na yung isa? So those were the things that they want to find out. And again, kung gila lang nating mura, whatever mura is, pupunta pa yung mga tao, or ganyan pa rin, titisin nila, magtitipid pa sa budget, mag-self-medicate pa rin sila. Okay. So just to give some examples now on why we do, why we believe that doing ethnography is one of the more effective tools in testing new ideas and new services, especially something that's very unknown. I give some examples now. So this was somewhere in Africa. The problem here was that we had water. So some quote-unquote innovators from the US thought like, what if we put this playground like a merry-go-round for them, and if kids play in this merry-go-round, it will pump water into the tank at the back. And what if we get natin mga ads and billboards, so kahit kumita for the village. So lots of money poured into this project, lots of PR, press and photography and awards. but it failed. Super failed. It did not perform it did not create the impact that it wanted. Any guesses why? Many reasons, but can anyone guess? Take a guess.
Guess?
Yes.
Maybe because they live far away from that place, so they had problems with transporting the water.
No. So one thing was this relies on the kids playing on this to pump water. How long will a kid play in a merry-go-round? So sandali lang. Like when the media is there, nice photo. When the media is not there, this is the reality. So it's really the parents na sila mag-igib. Mag-igib sa ikot sa ikot. So that's one thing. But the second thing is really that this was a foreign technology for them, so nobody really knew how to repair it. The moment it breaks down, it will break down. They don't have parts, they don't have the local expertise to fix it. So usability is one thing, but in the other parts of the ecosystem, in terms of repairability and stuff, comes into play. The other thing here is this one. I got this example from Kickstarter. So some engineers from the US thought that what if we create a soccer ball, add some motion generating battery inside, so that when the kids are playing with it, it can generate and store electricity, and in the evening, meron silang kuryente. So again, nice idea, gets funded, press, awards and stuff. Pero again, total flop because soccer ball it is. So pati sipa-sipa lang sila na yun. So ang bilis nasira, and then when the mothers were asking how much, so once it's broken, no one can fix it. So when they asked how much is this ball, and they say it's around $60 for the ball. And the mothers were saying, for $60, pakamitan mo ng kuryente. Just give me the money na lang sana. So, and again, so if you focus simply on one aspect of a design, like either the usability, the aesthetic, the coolness of it, there's a lot of other things that comes into play in terms of ensuring that will your design work. So again, you probably more familiar with this one. So when we were doing the research for Ayala, when we were we started visiting various health centers just to stay there and be with the people, and they were telling us their stories na minsan 5 a.m. pa lang pipila na sila to get a number kasi nga like limited in doctors for the day. So they line up at 5 a.m., get a number, and maybe at 8 or 9 when the doctor comes, then they'll have to wait for their turn. And of course, the doctor would tell us that again, there's a lot of people for the day, so I can only allocate certain amount of minutes per person. So kailangan nilang bilisan. And then, magpapa-lab test pa, babalik on Wednesday, then ulit yung whole process. So even though it's free, there's really a lot of pain points, and there's opportunity for things to improve. It's a process. Now, when we do user research, what we're also looking at is in what ways are people interacting with the things changing over time. The human need remains the same, but the circumstances keep changing. And for us, that's why we're always, I guess, that's why a lot of companies will hire us, because they always want to find out in what ways are the behaviors changing. So for example, when you're using telephones back then, ano yung mga conditions? Diba? Kailangan you must remember the number, you must have some private room, you're connected to the wall, you can't take it anywhere. But now with your new phone, there's a lot more freedom. You can do, calling is so much different than now. And whenever you're trying to understand, okay, will people use something? Will this new idea work? It always helps to go back to the past and try to find out ano ba yung difference ng dati at ngayon. Because a lot of times, if there are ideas, it's based on a certain set of assumptions, and again, those assumptions might change. For example, like the Me Too movement is very, very new right now. So kung anything moving forward in terms of movies, TVs, ad campaigns, it takes this new social trend into consideration. So like that example, yesterday customers might want gas lamps that would not set the house on fires. They want cheap meat, somewhere to get their films developed. Today, they want Instagram likes. You want environmental friendly houses, organic salads, etc. So again, you might have covered this in your session yesterday, but for us, ethnography is not simply just conducting interviews. You must combine the interviews with observation, immersing with them. Go into their context, finding out how they earn, how do they make decisions, who are the stakeholders, what are all the considerations in terms of their values, ano yung mga moral codes nila, ano yung mga diskarte nila in terms of getting by with life. So all of those things. It's also not simply just asking one key informant, not just asking the boss, the barangay head, the mayor, to give a perspective of everyone. We also make sure na parang top down and bottom up yung perspective. Para kompleto. Well, this is one of our studies back then. Parang we were conducting a research in Batangas. It was a rapidly industrializing town sa Santo Tomas. because of an industrial park. The industrial park there was rapidly changing the locality. All the farms were now being converted into new factories. All the small houses were now being demolished to become condos. And it's great na everyone felt that there was so much more money. People were saying, but I now have money, I now have income. There's less crime in the area because there's money. However, it just created a new set of problems. Sobrang traffic, sobrang pollution. Dati, meron kami mga composting practices dito. Ngayon wala na puro basura ng sahig. Ang dami ng mga mosquitoes and other problems. Philip Morris factory there, hinihika ng mga bata. So with every new, if you think about it, systems, every new variable that goes in will create unexpected and undesired results. And that's the sad thing. And no matter what kind of solution that you introduce, it will create some kind of unexpected and maybe undesired behaviors. So this is why I guess if ever you'll be researching, this is one of those things that we always have to keep an eye out for. Ano yung mga unexpected things. So when we conduct our studies, again, interviews and observations, almost always hand in hand. Never kami parang just one thing lang. And yeah, fast forward now. So people always ask us though, parang qualitative lang research niyo. What about the quant side of things? So we're not saying that parang quant, you don't do quant. So quant has its place. And whenever when you're doing quantitative, kasi it's more than just a question of what are you trying to answer. If you're trying to answer what does the majority think, then use quant. But in our case, whenever we're trying to explore, if you're going to introduce something new, a new policy, a new service, a new experience, a new program, then there's a lot of unknown things. Like you don't know how this will change the dynamics of things, how it will change the behaviors, and that's where qualitative can come in. And I guess the problem kasi with quantitative is that you can measure everything. But the question is, how do you know which one really matters? And I believe that's where qualitative studies can be helpful to narrow down what is it that's the most important thing to measure. So almost always, especially with regards to healthcare, systemic mga challenges namin. So how do we help make sure that people are maintaining their make sure that doctors are reporting mga TB cases, make sure people maintain mga TB na treatments. How do you help a lot of people sa mga cataract surgeries nila to go to operations? So in this case, on our end, what we're trying to find out first, okay, let's categorize it. Is it a clock problem or a cloud problem? So for us, clock problems are those na parang, ano lang yan, technology lang yan. You just need some time, maybe some money, some technology, and you can solve the problem. But for cloud problems, that's where, again, it's a bit more multifaceted. You need to attack this problem in many different points. It might take a lot of time, and it's like traffic or garbage pollution. You can't solve it now. It just needs a lot of time and a lot of effort. But at least on our end, we have to make sure first, what are we looking at? And then for that one, we're always trying to make sure that we try to find new patterns behind it. So one of the frameworks that we use is the iceberg model. So some of you might be familiar with this one. Iceberg model is basically saying that you look at the events, the trends, the structures, and the mental models to be able to describe a certain system. Okay, after picture. So events is basically what you see. So nagkasunog, nagka-earthquake, may building na nasira. You're looking at parang what is usually reported in the news. Oh, there's a malaria outbreak. X number of people now have HIV. All of these things are the events. And chances are, like when events happen, you do have to react to it. Wala tubig, then suddenly parang, mayroon bagong system to provide water for the areas that are affected without water. But you cannot stop at the events level. You should have a knee-jerk reaction at yung mga band-aid solutions level na it doesn't really address the long-term thing. So the next thing after events is that, okay, now you have to look for patterns. Does this keep happening over a period of time? Over time, dumadami ba? Over time, lumiliit? Over time, parang does this keep recurring maybe every monsoon season or tag-init natin, repeat ito mga certain things na to. So by knowing the patterns, then basically you're more able to ensure that it's not just a one-time thing. Once you have the patterns though, then you have to look for, okay, what if the pattern continually occurs and if it's ever over a period of time that it keeps growing, then almost always there's an underlying structure that's enabling it. So this would be the rules, the processes, the programs, ano yung mga reward systems. What are the things that that is ensuring that the pattern happens. And almost always, structures are made by the people in power. You know, someone made the rules. It's an uneven scheme. Someone said na parang gawin natin itong rules. Ito, ergo, the pattern is ito yung mga nangyaring traffic behaviors. But behind, underlying the structures now would be the mental models. What is the rationale? What are the beliefs that made those people in power to decide that this would be the rules? So just to give some example, I recently came from La Union. We were doing a study for the weaving industry. So basically some groups wanted to find out why is it that the young do not want to take up weaving. A lot of the weavings, artisan weavers right now, mga 60 years old na, ang average age. That's the average, so oldest mga 80s. And they're saying that parang in 10 to 20 years, if nothing changes, that's it. There will be no more hand artisan weavers. All the young ones that we got talked to said that I don't want to get into weaving. I want to become policeman, teacher, fireman, engineer, call center, other things. So we were trying to find out what's driving this. And when you start talking to the parents would actually tell us na parang kung yung anak ko magaling mag-aral siya, mag-STEM courses siya. Pero kung hindi siya marunong mag-aral, or wala siyang plano mag-aral, nabuntis at sa bahay lang, then doon to mag-hobby. So doon pa lang, you can already see like the influence of the parents to the kids with regards to their choice of career. Even if the parents are weavers themselves, they might want na, yes, this is my practice, this is my family, our clan's practice for the longest time. Hindi tayo kikita dito. And if kung kaya ko ng anak ko masense sa buhay, then papaaral ko siya at pumunta siya sa Manila, mag-ibang trabaho para kumita tayo. Because there's really not enough money in the current practice. A lot of those things again lead to parang the structures. Like the structures would be parang ano ba yung mga pinapractice in schools. And there is no course to teach weaving, but you have food processing, you have lawyer, nursing, but all the other things. So just to quickly summarize iceberg model is that even if you, example, let's say there's a factory. You tear down the factory, but if all the rationale that made the factory exist in the first place still exist, then a new factory will be rebuilt. Unless you address those underlying structures and unless you address yung mga underlying behaviors, just the system will persist. You can remove individual elements, but if the rationale exists, it will still maintain. So if you're trying to solve, example, let's say systemic healthcare problems, simply touching on like on the surface level interventions really won't change enough. So I want to share this. It's called the law of minimum, and it's something that we always believe in Curiosity. Is that you always have to make sure, like, if you're going to change something, you have to make sure, like, what are all the variables and what are all the minimum of every single variable. You might have a kid, and no matter how much money you place into your scholarship niya, no matter how much internet you give to the kid to study, but if you don't have enough food to eat, they won't have energy, they won't study. You can have, like, a developing country, toss in as much money as you can into that system, but again, if the political system is not in place to ensure that there's no corruption, then it's not going to go anywhere. So whenever we're trying to solve, especially for healthcare, we try to find out what are all the possible variables that has to come into play. You want to encourage a kid to go into STEM courses. Let's find out parang ano ba yung expectations nila in terms of income and availability in terms of jobs afterwards. Ano ba yung access nila to the school that has the course that they might want. And yung influence ng parents nila to the decision of kids. Can the kids imagine or do they even understand anong topic na to? Ano yung feeling nila sa peer pressures of mga fellow students nila if they do decide to go do something. There's almost always so many variables to consider. Which is why, again, it's almost always so difficult to solve mga systemic problems. So with that, I'll show you one example of a project that we did na healthcare related, specifically maternal health. So this was a startup. The startup na tinulungan namin, they said na parang they wanted to create a system where people, like especially the lower income segment, mga DE level, they can subscribe to this SMS-based service. It will connect them to a nurse, mga nurse na either volunteers or paid. And then you can text anytime and you will get the response, parang like responses to any of your questions. So parang live chat support. But they wanted to know, number one, would people want to use this? gagamitin ba nila? Number 2, would the nurses want to use this? And number 3, who would pay for it? Kasi parang like, what kind of business model do we do? Do we charge the parents? Or do we charge the government? Do we charge corporations? They just want to find out. So when we designed this project, first we had to identify muna what are the things that we wanted to answer. So again, so these were like some of the research questions. How do first-time pregnant and first-time mothers assess the relevance and usability of the service? Will they adopt it? What are the use cases of it? What are the content that people would actually want to use it for? If ever, how might the government work in conjunction with this service? And what are the other key insights that we can do to make it into a sustainable startup? So ang style namin dito was first we selected the mothers. We gave them the phone. Actually they had phones. So we had to make sure they had their own phones. And we just observed lang as they tried to register. We gave them a set of instructions na parang, okay, you have 1 week. Yeah, you have 1 week, and then you must use the service X number of times. And then babalikan ka namin after a week to see kung kamusta ang experience niyo with it. So we selected 20 participants for this one. And again, like in using with qualitative, you don't need too many. You don't need like 100. We selected 20. Half of them, mixed C2DE, 80 to 29, taga Marikina, and so on and so forth. So we had 11 na first-time pregnant and 9 na first-time mothers. And I'll just quickly go through some of the findings as we went through. So first was even the registration process. Again, ito lang observation. So parang binigyan namin sa kanila, live naman, automatic naman yung system. Na parang as they type in the code, na parang register, whatever, then we just observe lang and then just try to ask kung ano ba yung naiintindihan nila and stuff. Sometimes kasi parang for the creators of the app, they're engineers, they're coders, they're techies. And usually yung mga gusto namin malaman, like, are the language that you're using ba, yan ba yung naiintindihan ng mga tao? And ito rin mga some of the responses that they have. Parang text lang ba ito? May nakita ba kung nagtatanong ako? Lalo kung tinatanong ko medyo nakakahiya. May group chat ba ito? Or sino yung makausap ko? So these are like some important things naman na at least to get first impressions. Now, if, ito yung mga more consistent ones na ulit-ulit na sasabi ko. So overall, registration, wala nang problema. May mga tanong lang, example, parang you must have 1 pesos maintaining balance to use. They were all saying, ano to, what does that mean? We clarify for them. Yung welcome message sobrang haba, it was like chopped into 3 separate messages. And also, they weren't using smartphones, puro feature phone lang. Okay. So parang ganyan, like they would receive the message in 3 separate chunks and they would say, ang haba-haba niyan, like after reading the 1 out of 3, they stop reading. And when they stop reading, then they miss out on the instructions on the subsequent ones. They were also, upon subscribing, it will ask you certain questions. So ito yung mga things that they were actually very willing to share sa simula na. So first name, age, number of months pregnant, or maybe the age of the baby. These are information that they're very willing to share. Pero yung mga ayaw nila, address and personal experience. Now the thing is, ito parang automatic nagiging barrier na kasi simula parang hinihingi na agad eh. But for them, this was a bit too much. Na I'm not willing to reciprocate on what you're asking from me. It's a bit too invasive na hindi pa kita tiwala. So things that we wanted to find out, again, beyond just simply giving the app, we just simply talk to them para find out. So, kamusta na nga ba? Kung sakaling may mga tanong kayo, sino pipuntahan ninyo. So, they do share with us their stories na parang either sa mga kamag-anak, sa ate, sa nanay, kung sino yung mga kausap nila, or maybe to Google. And also, parang ano yung priorities, yung top priorities for their information. So first, we mapped out muna ano yung behavior nila before parent up. Like if they do need to find information, then when do they go to the doctor? When do they go to their mga family and friends? So just to map up lang. So kung light questions, sa nanay, sa tita, sa older ate, pero anything serious, then kailangan doctor agad. The problem though sa doctor is that usually either malayong doctor, hindi ko ma-reach, busy siya, kailangan mo pumili ng matagal. I feel mo yung tanong mo sobrang late lang naman, na it's not worth all the effort to commute and to wait just for that one question. Then with the app, they started using it, and after that, we go back to them to get yung mga answers nila. And in general, they were telling us about, okay, ito yung bagong behavior nila with parent up. If they do have still very simple questions lang, then they still go to the most immediate ones, the women in their lives nearby. Pero the moment that they do have a difficult question, they're very happy. Now I can access directly a health consultant. We tell them it's a health consultant, but in reality, nurse is on the other side. They don't know that. Then yun, so now they start asking the questions. And again, even the nurses naman will tell them na the moment na medyo serious na yan, then go to the doctor. Yan. So these sorts of, again, parang just a list lang of mga things that they were generally asking. So mga home remedies, mga common concerns such as side effect ng birth control pills, nagtanong sila about that. And especially mga parang other pregnancy symptoms. Again, this was just basically a list of mga information that they generally would ask. And for us, it was important to get these things because at least we would know that if we were to get more nurses or more whoever would be providing the content, then we had to make sure na kaya nila sagutin ito mga to. If ever they would be creating standardized answers, then at least ito yung mga, they should quite know or expect na ito yung mga ganun. So postpartum, infancy, etc. There was some of them though were telling us na parang minsan nahihiya sila. Even though we told them, walang bayad to, you can text anytime, kahit na gabi, kahit na midnight, you can text, may sasagot niyan. They would sometimes feel na parang nakakahiya, lalo kung masyadong mababaw na yung tanong nila, masyadong trivial. Kasi they feel na parang may tao dito, hindi ako sayang yung oras niyo. Or sometimes they feel like it's too embarrassing because they know my name. They know my name, they know my address, they know my name, they know my number, and baka di nila alam kung who else would have access to information, but if kumano. Mga demonstrations, so example, parang paano ko papaburp yung baby ko. So this was also, they found a bit challenging to explain over text. So ito yung mga, of course, they would, if ever, they'd still go to a person to demonstrate for me. So minsan rin daw, they would say na parang, even though I received advice through Parent Up, they still did not follow. And they would share sa parang bakit. So for example, either nga parang sabi, punta ka sa doctor, and for them, masyado hassle pa rin, mahal, wala akong oras, and so on and so forth. Or iba, parang like herbal medicine. Eh, tiwala ko to parang gumagana naman para sa atin. Even though sinabi sa inyo na stop taking that, do something else, they still tend to follow what they know. And then here, they do share, we do ask again, parang with regards to going to the healthcare centers, what's your experience, and mga challenges ninyo, how much does it cost you? And other tips that they wanted to ask, at least or other more information that they wanted to receive. Because if ever they would be, we asked kasi, parang kung sakaling Parent Up were to blast you lang, so it would just send you random tips on a regular, maybe on a weekly basis. What would you want to receive? So ito yung mga concerns. How frequent did you use it? So ito yung mga concerns nila, and they were telling us na paano ko gamitin ito kung wala akong load, paano ko yung phone ko hiniram ng tatay, kasi minsan one phone lang shared by the family, paano kung full na yung memory ng phone, and so on. In our study, then we were trying to map out like when were they more parang sending the message most often. But on the other hand, we were also monitoring some nurses. When are the nurses responding? Because the nurses are also working. So sometimes the response is not immediate. Minsan, let's say 4 hours later or 5 hours later, available the nurse. And even the nurses rin talaga, for the prototype, we had 20 nanays, pero we had 2 nurses lang na. So dinivide namin, 10 for you, 10 for you. So minsan rin daw sila na feel na overwhelmed, tuloy-tuloy sabay-sabay yan, and then they had to switch from one message to the next. For the nurses, smartphone sila, so at least mas kaya nila i-control yung threads. So we just clock in the response time. Again, in general, all the parents were telling us na sana mas mabilis. Kung 4 hours, 5 hours later pa yung reply, then I'd rather just talk to someone at least mas immediate if I need information. Okay. So, and then, I won't go through in detail, but ito, generally, after the whole study, ito yung mga assessment nila, what they think about it, how would they describe Parent Up, if ever, as a person? How do they feel warm? Do they feel na they can trust it? Do they feel estranged to it? What do they think about the name? How do they rate yung quality of the responses? Response time? What do they like and dislike about it? And then we talk to the nurses. So the nurses, at least they give us their feedback. Parang, how was it like responding to all of those questions any time of the day? So at least they would also tell us, parang sana may dashboard, sana kaya kong i-note ito. Ang hirap nisan for me to go back, read as many things as possible. Sana kailangan na notify ako, hindi ako kailangan mag-log on para yung feedback. And then next is, parang we also wanted to check, so who would pay for it? We did, during the post-evaluation, we did talk to the parents, parang, do you want pay-per-use? Do you want monthly fee or do you want subscription fee? So parang which one, and every single one naman may pros and cons. So kanya-kanyang sabi sila kung which one they want to. And then next time, I will try to answer.
Ask if these nurses have had full grasp of the cases of these patients.
Yes. So the nurses we selected, they were very, parang quite veteran nurses sila. And
Because it's so hard to recommend something, I'm a nurse, so it's so hard to recommend something without knowing the history, the comorbidities, or any, other factors that could influence the health of that pregnant woman.
so that was one of the feedback from our nurses. Na parang like, I don't know who this person is.
Yeah,
There's so many
because it's so
people.
hard. It's risky,
Yeah.
actually.
So they were saying parang like, can we just limit ourselves to one very general, either first aid or general health.
Because the problem, they could be very dependent. They could become dependent on that
Yes.
app and just depend on the recommendations and all of these nurses
Yeah.
without going to the doctors anymore.
So even sa simula pa lang, like when we especially sa waiver pa lang, we're already saying pa lang na again, this does not replace a doctor's advice. And like si parent na friend is saying, parang we're not trying to replace the doctor. So we just simply want to give them better access to information, given that they don't have access to information. Wala silang internet. But yeah, those are some of the limitations.
Is this something that's similar to telemedicine, or is it something na parang moving towards telemedicine? Or is it parang ano lang ba siya, like yung Mayo Clinic and the SP na text?
I'm not familiar with Mayo Clinic and
It is a Mayo Clinic, diba? Parang you click your symptoms and then sabihin niya na, ito yung possible.
So it's not that one. If ever, I guess it's more may tao. So it's not a bot. It's right now at least their idea was it has to be personal.
Yeah, but is it more like may questions lang, or nag-gear ba siya towards, mag-shift ba siya towards a telemedicine na yun na parang nagkakaroon ng, yun ba yung magiging vision nitong technology?
I think it's
as
more-
in information dissemination.
More of information dissemination at the moment, but again, they're really not trying to, at least this group's vision was not to replace doctors. It's just simply, kung wala silang internet, hindi sila masyadong mag-Google and search on their own, and hirap sila to access any doctors or nurses, what would be the best way to provide them those information? At least that's the scope of the problem that they want to address.
I used to like to ask, I'm an MHO in Samar. Yung bang mga nurses who are responding to the questions, do they have special trainings? I mean, like prevention or mental health, or how do they get the information that they are given to the clients?
Yeah, the nurses that they recruited na parang to work on this one, at least for that pilot test, was they were geared towards maternal, we were doing maternal.
Kasi madaming nurses, pero hindi naman, well, wala, yun lang din, kasi doctor ako, no, parang ang danger for me is yun, yung nag-avail ng service, they are relying on that service na, and they won't go to the, unless sometimes it's late na. So parang, sabi kanina, ito lang ang gawin, no. Alam mo yun, kasi kami, I don't know if you are familiar now with telemedicine, kasi the difference siguro with that sa telemedicine is because in telemedicine, there should be a health person who will assess the patient, who is there physically to see the patient, and then that usually is a nurse, but it's the doctor who refers to another doctor, always based like here in Manila, and then we, the doctors in the province, we would refer clients. But it's somehow similar but also different because it's like direct to the client, right? It's direct to the client. Yun lang, I'm afraid lang as a public health practitioner na yun. And then we require our pregnants to visit us like four times minimum according to the mentioned strategy. It's okay if those questions would come in between, but still they would visit. You would like also push them to visit to the center regularly because
They do naman. So again, no, it's never those nurses friend are also telling them kung kailangan mag-doctor kayo. They're never saying na I can solve all your problems. So kung may tanong lang kayo, minsan nagtatanong na yung baby ko umuubo, and then they'll just try to ask some questions and module, things like that.
Or maybe before they enrolled in that particular app, they could have a thorough assessment and history from a doctor and nurses, and this team will be the one to follow up all their succeeding questions and concerns.
So that was one of the, at least the recommendations, parang if they were to
Yeah.
launch this, sana lang dun sa registration process, they can tie up na with the local health centers.
They have to have initial
Yeah, kasi-
contact with all these healthcare professionals before they enroll there, and then if they have concerns, then that's the time you keep on, answering, because you have the baseline data anyway. So more or less.
There's also question kasi parang, how do you even get them to register? Like, who will tell them that this service exists?
Ayan, something to add lang man, kasi parang, I'm not a doctor, pero I think I have the same fear with the doctors. Kasi, so, for example, I'm a member of a makeup group in Facebook. And yung mga tao doon, di ba, sometimes parang may pimple ka, then people would be friendly at tell you na, ito yung lalagay mo, ito yung lalagay mo. And then there are instances na medyo nakakatakot na yung pinopost nila, parang tinatanong nila doon sa mga tao na, ano yung pwede ilagay dito? And then people freely just, I get that na nurses yung sumasagot, but parang yung behavior ng mga tao, is since may sumasagot sa kanila, na parang, ito yung magandang gawin, ito yung magandang gawin, ito yung tinry ko, ganyan. Parang hindi na sila nagdo-doctor, tapos sinusunod na lang nila kung ano yung sinasabi. So
Yeah.
parang I think it's the same with that. Tapos parang is there also a vision na, di ba, Gar, sabihin ng nurse na, this is something na I cannot definitively answer now, pero it's best if you contact a doctor. Is there a vision or like a step in the future na i-attach siya sa isang network ng mga doctors para magkakaroon ng referral system, para hindi hanging and yung patient na,
Yeah.
okay.
So, I definitely agree. Kasi example lang, right now kasi, no, like I said, system nga eh. Kung if dito kanya lang mag-access sa nurse, pero sabihin ng nurse, punta kayo sa doctor, but if the way to access the doctor is quite difficult, then bungi pa rin eh. So, yun yung, again, at least for this group, hanggang dyan yung scope na rin. But those are the other things pa.
You don't need the doctors all the time. Nurses are okay as long as the nurses have
You can
background
advise for mention and for further.
of the case of the patient. That would be fine.
For the other concern yung yun rin actually we bring up some of the parents eh. We tell them na may health professionals on the other end. They're wondering, sino sila? They don't see a face. It's not text message. They're wondering, like, sino itong mga tao sa sabi niya? Baka kayo ito, may sumasagot sa amin. Kasi, baka ito eh. So, and yeah, like, they don't know. They don't know who. So, those are the other considerations for them. Parang, right now, kasi they're trusting us na the one who's answering is actually someone who's quite, who's credible. But they don't know. There's no face. They've never met them. There's no name red. We never, when they receive the messages red, it just says parent up. They don't receive the parang this nurse blank or nurse blank.
I understand that your involvement is just for user research, right? You're not in the development of the program. So my question is, or our question is, what happens now when you tell the developer or your client that program or that app or that product is not effective? So, will you still be involved in the Will you be involved in the redevelopment or reconceptualization of the project or the product?
So that's two separate questions.
Yeah.
If they'll still re-involve us, if they'll re-involve, if let's say they want to hire us again, but they're not going to change or they're not going to do anything about anything of the things that we recommended before, and then we think that's not going to go anywhere, then we even ourselves, we probably would say no. But if they are going to work on those things, then they need our help to discover other things, but then we'll do our best.
This is the most active questioning I've seen.
We can relate.
Finally, we can relate.
I think Birdies is the only invitee for this entire fellowship who is not directly in the academe, right? I'm not so sure if you're teaching.
I used to teach, I stopped.
Right, but I mean, all of our speakers mostly are really current academic practitioners, and I think for one reason is because the network that we have here in USD is just on the teaching group, right? The reason why I invited Birdie is because he is co-founder of Curiosity. He's a good friend of mine who has been telling me a lot of the good works they've been doing. And so we were both fellows in Brown. So when I heard about this, I was thinking, it might be a good thing to bring in to our fellows because we rarely talk to people who use anthropology to study something of, let's say, of a health crisis or a health app or whatnot. And it's also interesting their input, right? I mean, the medical practitioners or people from DOH are suddenly, hang on, based on our practice. So I guess there's more space for research on this. If you would like to know more about Curiosity, they have an active website, and I think he flashed it a while ago. And I suppose there, curiosity.ph. Easy to remember, right?
I should update the website.
I should update, okay. Yeah. Right.
It's updating.
I think it's very important to see these things work because as an anthropologist, I study anthropology just on, the surface version of anthropology, like academic version of it. But Pam, who is an anthropologist, decided to go against the grain and design things. And I think that's where you guys have collaborated on this. Are you sure no other questions? Are you excited for the photo? Is that it? All right, if you're ready, if you don't have any other questions for Birdie, before I forget to clap again, before I forget that, please let us all give Birdie a good round of applause. Now I'd like you to